Hello, everybody. This is Faye, and I sell Medicare plans. So we have a different screen view today, and it's because what I want to talk to you about is like, huh? What you say? So it's really about HMO or PPO. Which of the Medicare Advantage choices are you most familiar with? Which are the ones that it's like kind of like your go-to? So are you asking yourself, how do you choose what you should be offering, the HMO or the PPO? I don't think I need to go to the basics and tell you HMO stands for Health Maintenance Organization, and PPO is Preferred Provider Organization. So you need to know the difference, of course. You need to know the difference between the HMO and the PPO. And that's how you're going to be able to match what your customers' needs are to the right product. It all comes down to a thorough needs analysis. So the product that you choose to offer has to meet the customer's needs. You're the solutionary. You're the person who solves the problem that the customer has. You're the person who the customer looks to be the expert at which should be better for them. Remembering always that these are annual plans, so plans change, customers' preferences change as well. So it's not going to be your decision if it's HMO or PPO. You're the guidance. You're the person that's going to guide them. You're going to guide the customer to what fits them better. So when the customer is given the correct information, they can then make an informed decision. It's an educated decision because you've helped them to understand what they've chosen and why they've chosen it. There are less chances of someone coming back during the year and saying to you, or saying this, going to someone else and saying that you gave them the wrong plan, or that they need to switch and someone else comes along and makes that switch because the right choice wasn't made from the beginning. But it also means that once you help the customer to decide if it's HMO or PPO, you're going to stay with them throughout the year to see if there are some changes in their preferences, if there are some changes in what their needs are, and if there's something that you can help them with. So besides the usual needs assessment, there are three most important things that come to mind that you need to do during the year. You want to know, or you want to let your customers know, that the plans are annual. So what's going on during AEP for next year may not be the same thing that's going to be in place for the year after that. So have them thinking and knowing from the very beginning that it's 1 year at a time. Obviously, they can stay in the plan if it works well for them, but you want to make sure that they know the plans are annual and they change. Also, let them know that there are changes that are coming up in the plans that we're now looking at during the annual enrollment period, and that they clearly understand that that's not locked in stone forever for the rest of their lives, that those plans will change too. So during the course of your conversation with the customer, if they understand those things, keep repeating them periodically within your conversation so that it's clear to you what's most important to the customer, and the customer understands what's important for them. So let's talk about the three most important things that you might look for when you're choosing HMO or PPO. Like plan changes, these are the most important things that you really want to hear from your customer. You want to know about affordability. If they are looking for plans that have the least out-of-pocket cost, overall cost, you want to know if they're looking for plans that where their doctor is in network. You want to really cover what's going to be the lowest overall cost if you're looking at the HMO plans. The lowest overall cost and the most value. Lowest overall cost and the most value. That's going to be your HMO programs. So within that lowest overall cost, you're looking for the lowest medical maximum out of pocket, the lowest medical MOOP, the latest laws for Inflation Reduction Act. It's already taken care of the maximum for prescription drugs. So you're going to look for that overall medical maximum. You're going to look for the lowest deductibles if the deductibles apply. And they may apply for both the medical piece and the prescription drug piece. So you're going to look for those plans that have the lower deductibles. You're going to also look for the plans that have the lower copays. And one of the copays that stands out and differs between plans is inpatient hospital. The other copays are generally in most of the plans about the same, maybe $10 to $15 difference between them. But inpatient hospital can be a real expense for someone if they're hospitalized during the year. So look at that as one of the copays and look for the plans that have the lower inpatient hospital copays. Skilled nursing is another one that can get people to their maximum out of pocket. So look for the plans and look at the differences between the skilled nursing benefits. Now, when you're looking for the best value in the HMO plan or the most value, you're going to look for those plans that have higher benefits like over the counter, who has the most dental, vision, or hearing, whichever of these are important for your customer. Certain plans that are HMO plans will offer more fringes than others. And you will learn those as you're doing the comparisons. Some plans may have transportation. Some plans may have 24 round trip rides. Some plans may have 36. Some plans may have unlimited. And then some plans may not have transportation. Is transportation important to your customer? These are the things you're looking for that's going to make this plan, the HMO program, the better choice for the individual that you're working with. You have to make sure with the HMO plan that all the doctors that they want to see are in network, because all of the services are provided in network unless it is a true emergency. Now, with the PPO, it's a little bit different. Customers can choose to be in network or out of network. So for those customers, you're going to look to find out what it is that they need most. Do they travel? Are they in certain parts of the country one part of the year and another part of the country another part of the year? Do they go to live with children during certain seasons? Are they looking for specific doctors that are not in network and the HMO, but may take the PPO plan? Do they want the flexibility of choosing when they can go in network or out of network? Just having that choice is important to some people. So the PPO product then works. And you're going to look for the same things. You're going to look for the ones that have the lowest out of pocket cost overall, the lowest medical out of pocket cost in network and out of network, the ones that offer more value. So you're doing the same comparisons between PPO plans that you would do during HMO plans. The choice is still going to be for the customer. What you have to remember is that HMO requires in-network services unless it's an emergency, can have a lot of fringes because everybody that's in the HMO product is already contracted. The insurance company knows what it's going to cost to provide the services. PPO gives the customer choice. So the customer wants that choice, they're going to have a higher out-of-pocket cost. So when it comes down to HMO versus PPO, if the customer is looking for the better benefit for them, fit it to what they say they actually want. And then continue to be with your customer to be sure that that's the best program for them for the year. This is Faye, and I sell Medicare plans. If you need any help with comparing plans in your area, you know how to reach me. Thank you so much for watching. Thank you so much for subscribing to my channel. Click the bell so that you can get notifications when there are new videos available for you. Thank you so very, very much.